This call. Yeah, Dr. Pooja, am I audible?
Yes, yes, you are audible.
Yeah, I just started the live streaming in YouTube, so I believe we should start. And
Okay,
others can also join in both YouTube and this meetup. Yeah.
okay. So, hello guys. Am I visible or not? Okay, just let me share the camera also. Okay.
Y- yeah, now you are visible. I'm starting the recording. Yeah.
Yeah. Okay. So, good morning to everyone. First of all, myself, Dr. Pooja. I am assistant professor in emergency medicine, currently working in Himalayan Institute of Medical Science. So, today's topic for the mock practical exam is the BLS and ACLS. So, what is BLS and ACLS? Is basically I wanted this to be interactive, but abhi because we don't have that much time, so I will just brief in 10 minutes, then we'll go ahead with the questions. In those questions, if anybody is having any question ki is not clear or wants to ask any question, they can put in a message. Okay. So first of all, what is BLS? BLS is the basic life support. Basic life support mein basically we are not using any kind of the instrument or drugs anywhere when we are finding any individual lying down on our road. So the our goal is to recognize in the patient ki whether he is in a cardiac arrest or not, or after recognition give the ab- accurate care to the patient or initiate the CPR is the BLS. Okay. So foremost important step in the BLS, when anywhere we are, let's say if you are going for the running or if you are just walking through and you are finding an individual lying down on a road. So first step in a BLS is just before going towards that patient should be seen safety. Okay. So before you going anywhere, you have to see the scene. कि ऐसा तो नहीं है कि if you will go then it will become problematic for you. Now, then identify whether the patient is in a cardiac arrest or not. So, whenever a patient is in an unconscious state and you are reaching there, you have to tap the patient. Ki, hello, are you okay? If patient is not giving any kind of the response, you have to check for the central pulse. Central pulse we see in a carotid area. This is our carotid. Okay. So, how do we see? Central line, trachea, just slide your three finger groove between the anterior part of the sternocleidomastoid and the trachea. Here you can assess carotid. Okay. So carotid and the femoral are the central pulse which you have to see to diagnose whether the patient is having pulse or not. But the we should not check for more than 10 seconds. Less than 10 seconds, if we are not finding the pulse, we have to initiate with the CPR. Now, CPR, it should be high quality CPR. There are some basic points ki how we are going to give high quality CPR. So, high quality CPR में क्या होता है? There are 5 to 6 points which you have to keep in your mind. किस रेट से देना है? उसके साथ में कितना एयर देना है? How much depth should be there? Minimize the interruption and पूरा recoiling देना है. So, कितना देना है? So, it should be 100 to 120 per minute CPR. Chest compression should be there. It should be push hard and push fast. Now, whenever we are pushing too hard and too fast, we have to keep one thing in our mind ki chest recoil should be complete, so that whatever air we are giving, so proper ventilation should be there. Now, if anything we want to do, let's say if we are putting a airway in a ACLS, या फिर if we are putting a IV line, if we are not able to because of the CPR, minimum 10-second interruptions we can give, but more than 10-second interruption we cannot give. Okay. So after giving the CPR, we have asked for the AED. AED will analyze the rhythm and whatever it will be shockable or non-shockable, that will be studied in a ACLS. According to that, we'll further manage. So this is our BLS. So we'll go through the 3 questions of the BLS, which I have kept in our presentation. So, Dr. Akif, can you show to me questionnaire slide first? First question.
Okay, I will move one minute. In which slide it is? Okay, this one, question number one. Please go on, Dr. Pooja.
Question number 1. Yeah. I'm not able. Question number. This is the question. First, second. Question number one slide. I want.
Okay, 1 second. I will represent it because seems like it's not visible on the screen. 1 second. Okay, please go ahead, Dr. Pooja.
Okay. So, uh, okay. So I would like if somebody will give me answer on messages. Okay. So my question is, which of the following is performed before the BLS? Make sure the scene is safe. Activate the EMS and get an AED if available. Tap the victim shoulder and say, "Are you all right?" All of the above. We do have a message. Okay, Himanshi is saying all. Okay. Anybody else? All of the above. Okay. Anybody else? So Himanshi and okay, Ashish scored a A. Okay. Okay, so it's we don't have that much time. So Ashish, you are right. Which of the my question was which of the following is performed before BLS? Okay, so activate the EMS and get in AED, tap the victim. This includes a part of the BLS. As I told you in the BLS before starting, ki the most important thing in the BLS, check the scene. Because if we are going in a kind of the scene where you are not safe, then rather than you can become a victim. So the question is very clear, which of the following is performed before BLS? Answer should be make sure the scene is safe. Then only you can start your BLS step. Okay. So BLS steps include, first of all, what? Identify the scene. Scene is safe. Then second, you have to check for the response. If the response is not there and central pulse is not present, then you have to call for the help before initiating the CPR. Okay. So first, scene safety. Second, check the responsiveness. Tap the shoulder. Third, call for help. Identify करने के बाद में, then third is call for help. Then initiate CPR. After initiating the CPR, whenever the call or help is coming, they will put on the AED and they will analyze the rhythm. In between, if you are thinking patient is not breathing as well, if you are a two provider, then what you can do, you can give breath also. But usually in BLS, because we don't have any kind of the ambu bag, and right now nowadays we don't use mouth to mouth breathing, so you can just stick with the CPR. Okay. Now second question. Okay. So, a 24-year-old male brought to the emergency medicine department in unconscious state with a history of sudden onset of chest pain. What is the first thing you will do as ED resident? So, patient हमारे पास आया है unconscious state में है. This is a in hospital patient. Now, what you would like to do? Check RBS, put on monitor, check radial pulse or check center pulse. Vishal Singh, okay, D. Very good. Okay, Himanshi, what she is saying? Okay, anybody else wants to answer? So Vishal, you are right. So answer would be D. We have to check for the central bus. In a emergency setting, in a hospital setting, whenever a patient is coming and you know the patient is unconscious, he is not responding. So first thing we have to do to check the central pulse. If the central pulse is not there, we have to initiate the CPR. Okay. Now question number 3. Yeah. So correct sequence of steps of BLS CPR is A. Chest compression, airway breathing. B. Airway breathing circulation, circulation airway breathing, or assess care early or begin CPR check pulse. Who would like to answer this? Anybody? Okay, A. Okay, so answer will be A. Previously, it was there कि first we have to maintain the airway, breathing and circulation. But After this, American Heart Association has certified this BLS and ACLS course. They have recommended the use of the chest compression first instead of the airway, has seen the better result rather than using the airway, breathing and circulation. So we'll stick to that. The correct sequence of the steps of the BLS CPR is the chest compression, airway and breathing. Okay. 4. Question number 4. Okay, right. So we just talked about in BLS high quality CPR. So which of the following is true about the chest compression? Push hard and fast, ensure full chest recoil, minimize the interruptions, all of the above. Very good. Okay, so this was the normal. So before going to the fifth question, we'll go to the ACLS. Okay. Dr. Afi, can you show the second slide which we have put? Second slide. Yes. Yeah. So this is the normal. Start the CPR. Okay. And right. So this is our basic cycle in ACLS. So before going to this cycle, I would like to tell you ki why we call it ACLS. ACLS means it is a advanced cardiac life support. Why we are calling it a advanced? Because in this thing we are using drugs, we are using instrument, and we are further monitoring the patient. So this is why we called as a advanced cardiac life support. So what does that include? So first BLS we have given. Now the patient is with you. Now AED already came. Now we have analyzed the rhythm. Rhythm, now whatever the rhythm will be, shockable, non-shockable, will go to later on. So now how we have to treat this patient depend on with what complaint and what kind of the rhythm showing on the monitor. So now in this cycle, if we'll go, we already have done BLS, we have started the CPR, we have given the oxygen, we have attached the monitor and defibrillator. Now, after completion of the 2 minutes of the CPR, या फिर as soon as possible as the AED or the defibrillator is coming, we need to check the rhythm. Okay. Now let's say rhythm check. Rhythm check करने के बाद में we'll get 4 type of the rhythm. If the patient is not having pulse, either तो it will be ventricular fibrillation, either to it will be a pulseless VT, either to it will be asystole, or it will be a kind of the activity is going on, but you cannot see ki what kind of the activity is this, some kind of the electrical activity, but pulse is not there. Okay. So now on the basis of these rhythm, our decision and our treatment get changed. So shockable rhythm and non-shockable rhythm. So shockable rhythm are ventricular fibrillation and pulseless VT. You have to keep on this thing, pulseless VT. You can find a monophasic, monoventricular tachycardia. You can find a polyventricular tachycardia. But if the patient is having pulse, shock देने का जरूरत नहीं है. That depends कि patient अगर unstable है या stable है. That will go on a tachycardia algorithm पे. But in case of CPR, when we are giving a CPR to the patient on monitor, if we are finding it is a pulseless VT or ventricular fibrillation, we have to give shock. Now, how much shock we have to give, that depends on the kind of the defibrillator you are using. So defibrillator came as a monophasic also and the biphasic also. Most of the hospital setting may we have the biphasic defibrillator. So biphasic defibrillator, you have to set 200 joule, then you have to give shock. I will come to how you have to give how much after, like after giving how many minutes of the CPR you have to give shock, how many after giving how many shock you have to give drugs, after how many shocks you have to give epinephrine in both the cases. Now we'll see a case scenario. Let's say a 35-year-old male is coming to the emergency, okay, with a complaint of the sudden onset of the unconsciousness presented here. We have already done the BLS step. We have checked the pulse is not there. Now we have already initiated the CPR. One person from our team is taking care of the airway. We are ambuing the patient. Now, as soon as the AED came, we have analyzed the rhythm. Now there is a thing. Most of the doctors here for junior as a resident doesn't know ki how when we have to give shock. So in shockable rhythm, as soon as AED came, you have seen the rhythm, irrespective of that, ki whether you have completed the 2 minutes of the CPR or 1 minute of the CPR, if the rhythm is showing VF, you have to give the shock. Okay, as soon as possible. Currently, we are discussing about shockable rhythm. Okay, so जैसे ही AED आया, you have analyzed the rhythm, you have shocked the patient. Now after giving the shock, you have immediately resumed the CPR instead of checking pulse or reanalyze the rhythm. You have to immediately come for the CPR for next 2 minutes. After 2 minutes, you have to reanalyze the rhythm. You after 2 minutes, you have to see the pulse whether the pulse came or not. Now in this case, there are three scenarios. First, pulse वापस आ सकता है. After 2 minutes, you have to check. If the pulse has came, ROSC achieved. Further, the post-rock treatment जो हमें देना है वो देंगे. Now the second case, if the pulse is not there, okay, and analyze, we are seeing again ventricular fibrillation or pulseless VT. Then again we have to give shock. Okay, this will be our second shock. Now third scenario, if the patient is not having ventricular fibrillation but patient is having some pulseless electrical activity, pulse is not there. So what you will do, you don't have to give shock. What you need to do, take an IV line and give epinephrine. Okay, so this three scenario will be there in any kind of the patient if they are coming with the first ventricular fibrillation rhythm or unconscious state. So first ROSCE achieved, let it go. Now second VF. Now second, again if it is a pulseless VT, you need to give second shock. Okay, now after the second shock, you have to take an IV line, and after the second shock, you will get epinephrine, and after the third shock, after completion of the 2 minutes of the CPR, after the third shock, you have to give amiodarone. Amiodarone dose should be 300 milligram IV bolus. Okay, in case of the pulseless electrical activity, after you have already given a one shock, and if it is showing a pulseless electrical activity or asystole, then you have to go epinephrine every 3 to 5 minutes, and you have to rule out the causes ki why there is a pulseless electrical activity. So comes to the VF and VT. Now the question arises, we have giving three shock, we are giving epinephrine, we are giving amiodarone. Okay, now after giving the amiodarone also, let's say if the patient is again is having VT, so question arises, till what time we can give shock, till what time we have to continue CPR. So there is no as such correct answer for this. You can continue as you are thinking. If you think patient is young, you want to continue for 40 minutes, 1 hour, 1.5 hours, you can continue with that. And every time if you are finding a shockable rhythm, you have to shock the patient. After giving the 300 mg of the amiodarone, you can continue with the 150 mg of amiodarone, and then later on give as an infusion. Apart from the amiodarone, we can use another drug in CPR is lidocaine. The dose will be 1 to 1.5 mg per kg. Okay, so this will be our shockable rhythm algorithm. Okay, now third scenario was the pulseless electrical activity. In this case also, you can continue CPR as you want to. If the patient is young, if the patient is a very sudden onset, if he is coming with a history of only 5 minutes of unconsciousness, you can continue till 1 hour, 1.5 hours as you want. But you have to rule out the causes. Now comes to the causes. Basically, if we are getting a asystole or if we are getting a pulseless electrical activity, so there are 5H and 5T, which are the reversible causes. If we can treat those causes, we can treat the patient. Patient can get a ROSC. So what are those 5H and 5T? So these are your 5H and 5T in this slide only. If you will go ekdam down mein, okay. So reversible causes, 5H, hypovolemia. If the patient is having trauma, if the patient is having severe acute gastroenteritis, if a patient has lost so much of the fluid, you can start, if you can give the fluid, then patient will get ultimate ROS. Hypoxia, hydrogenema, severe metabolic acidosis, hypo and hyperkalemia, hypothermia. So these all are the reversible causes. If we are getting asystole and pulseless elective, try to find out the cause and treat the cause. Now 5T, tension pneumothorax, tamponade, toxins, thrombosis, pulmonary thrombosis and coronary thrombosis. Coronary thrombosis is equal to MI. So for the treatment, I cannot go in this video because it will be too much. All the doses, all the shock doses, kitna dena hai, kitna nahi dena hai, is written on this slide. You have to go through it. How much ventilation to, how much chest compression to ventilation ratio kitna hona chahiye if you are a single rescuer, if you are having two people, then how much it should be. When you have to intubate the patient, first the rouse should be come. If you are confident enough, you can do without the interruption or less than 10 seconds of the interruption, you can go ahead and put the ET tube also. Okay, so this is our ACLS algorithm. Anybody is having any question? We'll go to the question then. Okay. So this is our ACLS. We are gonna to go for the questions. Akif, if we can go to the question number 5th. Right. So as I told you, why we call this ACLS advanced, because in this we are using advanced drug, we are using advanced instrument to treat the patient. So now the example of the question is, example of the advanced airway adjuncts include all of the following except. What should be the answer? Anybody? Okay, Vishal A. Good. Anybody else?
Oropharyngeal airway.
Very good. Why? May I ask the question? Swati, who gave this answer? Vishal, you can open your mic and you can tell me the reason why this is not an advanced airway adjunct.
Ma'am, am I audible?
Okay. So definitely, yeah, Vishal. Yeah, you are audible.
Ma'am, because in case of if
So
we are
why
giving a
the
CPR, pharyngeal airway might not maintain the patency that we actually want for the airway.
so your answer is right, but the reason is not. So basically, it is a definitive airway. Okay, patency, you are right. But basically, any tube which is going through the vocal cord, okay, it is a definitive airway. Above the vocal cord is not a definitive airway. ओरोफेरेंजियल एयरवे क्या करता है? इट जस्ट टू ट्रीट कि तुम्हारा टंग फॉल ना हो और जो तुम्हारा ओरोफेरेंजियल है उसको पेटेंट रखे, दैट्स इट. ओके. So answer will be oropharyngeal airway. In this, all the tubes we are putting the tube below the vocal cord. Okay. Next question. Yeah. So everybody should know, after providing a shock with AED, you should start CPR, begin with the chest compression, check a pulse, give rescue breath, let the AED reanalyze the rhythm. This I told you. So answer will be Ashish A. Okay, very good. Okay, so it is very simple. I have told you. So after giving shock, आपको कुछ नहीं करना है. You have to immediately assume your CPR for next 2 minutes. After 2 minutes only, you have to analyze the rhythm. Okay. Next question. Yeah. So which of the following is a shockable rhythm?
D.
What? I'm not getting. विशाल क्या लिखा है आपने? Shockable rhythm बेटा.
Pulseless electrical activity.
I told you pulseless electrical activity is not a shockable rhythm, beta. So shockable rhythm are only two: pulseless ventricular tachycardia and the VF. In these all four, we are having monoventricular tachycardia, sinus tachycardia, asystole and PA. So asystole PA is non-shockable. Sinus tachycardia होगा तो patient को क्यों ही देना है? It is a normal one. Now the only we left with monoventricular tachycardia. This was just to confuse you. It is ventricular tachycardia only, beta. ठीक है? If the pulse is not present, shockable rhythm तभी देख रहे हैं because the pulse is not present. So answer will be monoventricular tachycardia. Okay? Keep this thing in your mind. Asystole and PEA is a non-shockable rhythm. Okay? चलो next. Which of the following is a non-shockable rhythm? अब ये तो अभी मैंने just बोला है. You should be giving answer.
Both.
So just discuss beta. ठीक है? It should be C, A and B both. Okay? चलो next. नेक्स्ट, ये क्वेश्चन नहीं आ रहा है, ये रिदम आ रही है।
Yeah, Dr.
रिदम एक
Pooja,
बार
is
मैं
there any
दिखा
other slides?
दूंगी उनको,
Okay,
जो
I
है
got
ना
it
दूसरे
now.
उसमें।
Yeah, I got it now. Yeah.
हाँ
Question
यार,
number 9.
yes, okay, so there are two different algorithm we used in ACLS, like algorithm for tachycardia, algorithm for bradycardia. Because it was just a brief session, I cannot go ahead with this. In ACLS, we have MI algorithm, we have a stroke algorithm, we have choking algorithm, but time nahi hai, so we cannot go ahead. But you should know which drugs are involved in bradycardia algorithm. Okay, so anybody, okay, atropine, epinephrine, okay, very good. Anybody else? Anybody wants to answer? Who has given this answer? Vishal? Okay, Vishal है, Swati है. Okay, good. So, if a patient is coming in a block, pulse is not present, या third degree block है, patient is unconscious, bradycardia है, patient अगर unstable है, okay, patient अगर unstable है, then we have to follow a algorithm. So, atropine usually we give as a starting drug. Epinephrine if the patient is not मेंटेनिंग बीपी या फिर उसकी पल्स चली जाती है, देन वी हैव टू गिव एपिनेफ्रिन. सो आंसर विल बी एपिनेफ्रिन. नाउ अदर ऑप्शंस अगर हम देखें, नॉर एपिनेफ्रिन, लिडोकेन, एडिनोसिन. सो एनीबडी कैन टेल मी कि वेयर वी यूज द एडिनोसिन?
Supraventricular tachycardia.
वेरी गुड. ओके, how much dose we have to give adenosine ka, and in which case it should be contraindicated? We have to ask that history from the patient. If the patient is coming to you, he is having PSVT, so you will
Bronchospasm.
give without asking any question directly,
Bronchial
या फिर so
asthma
bronchospasm
history.
नहीं पूछोगे ना? Exactly. ठीक है, very good. So how much
History
you
of
have to give
bronchial asthma.
adenosine? How much you give adenosine?
6 milligram to 12. 6 to 12
First,
milligrams.
6
12,
first
12.
बोला जाता है बेटा, second 6, 12, 12. Yeah, now it has been changed, 6, 12, 18 we can give. Okay. Okay, cool. Lidocaine का मैंने dose बताया था. What will the dose of lidocaine if we are having arrhythmia?
1 to
Okay, let it be.
1.5
It is 1 to 1.5 mg. हाँ. एक final question होगा आकिफ ना, 10. Yes. So, this question goes to everybody. After completion of 2 minutes of the CPR, the ECG monitor displays some electrical activity and patient has no pulse. Another member of your team resume the CPR immediately. What management steps is your next priority? No. Answer? Okay, C, okay. Okay, my question changes. If there is VF, या फिर torset is depointed we are getting and we are not getting the pulse, then what should you do? Immediate. You can open your mic and you can tell me.
Shock.
Shock. Okay. Okay, good. Okay, Dr. Akif, my I guess questions completed. If you can just go through that slide, I will just tell them. Okay, so this is, yeah, yeah. So this is your basic algorithm. Everybody is able to see?
Yes.
Okay, so this is your basic ACLS algorithm. Okay, for any patient you are finding lying unconscious, you have to verify the scene, check for the responsiveness, shout for any help, activate emergency response, get an AAD. Okay, now this part completed BLS. Okay, तुमने CPR करना चालू कर दिया. Now, sorry, not BLS complete नहीं हुआ. This is तो you have done till that आपको call for help के लिए बोल दिया है. Now, look for no breathing or only gasping and check pulse. If the pulse is definitely felt within the 10 second. Now, अब इसमें 3 सिनेरियो हो गए आपके. ठीक है. Now, the पहला सिनेरियो will be normal breathing, pulse felt. तब आपको क्या करना है? मॉनिटर करना है till the time एम्बुलेंस या फिर कोई हेल्प नहीं आ जाता है. Okay. Now, the rest 2 scenarios. Let's say ब्रीदिंग नहीं है, गैस्पिंग में था, लेकिन आपको पल्स मिल रही है, ही कुड बी इन अ रेस्पिरेटरी अरेस्ट. सो व्हाट यू हैव टू डू, यू हैव टू प्रोवाइड रेस्क्यू ब्रीदिंग्स. यूजली वी गिव 1 ब्रेथ एवरी 6 सेकेंड और 10 ब्रेथ पर मिनट यूजली देते हैं. ठीक है, अब इनको देने के तरीके क्या हो सकता है, आप माउथ टू माउथ दे सकते हैं इफ यू आर ओके विद दैट, या फिर यूजली एक मास्क आता है that will be round in a shape. Nowadays we are not using that. You can keep over the patient mouth and you can give the breath. Okay, now third scenario, कोई ब्रीदिंग नहीं है पेशेंट को एंड द पेशेंट इज गैस्पिंग कर रहा है और पल्स नहीं है. नाउ यू हैव टू स्टार्ट द सीपीआर. द साइकिल शुड बी 30:2. 30 compression you have to give, and after 30 compression you have to give 2 breath, and then as soon as the AED is coming you have to analyze the rhythm. Now after the rhythm you are checking if it is a shockable, you have to give shock. If it is a non-shockable, you have to resume the CPR and go ahead with the ACLS algorithm which I told you. Okay, next. Okay, this I already told you. Okay, so we'll not go through that. This is the again the same algorithm. Okay, now this what I was telling you. This is very important. You should know when to give shock, when to give epinephrine, and when to give amiodarone. So now see, इसको मोटा मोटा देखते हैं. शॉकेबल रिदम है तो फर्स्ट वी विल गो टू द नॉन शॉकेबल रिदम, एसिस्टोली और पीए राइट हैंड साइड में. ओके, सो जैसे ही वी हैव एनालाइज द रिदम थ्रू द एएडी एंड वी आर फाइंडिंग एसिस्टोली और पीए, वी इमीडिएटली आफ्टर गिविंग आईवीएसएस वी हैव टू गिव एपिनेफ्रिन. ओके, and then we have to repeat every 3 to 5 minutes and we have to continue with the CPR. 2 minute analyze, 2 minute analyze, 2 minute analyze, and 3 to 5 minutes में epinephrine देते रहो. So it is very simple. Now come to the shockable rhythm. As soon as the AED has analyzed the rhythm, it is VF or pulseless VT. Immediately, irrespective of the at 2 minute or 1 minute or how many minute of the CPR you have given, immediately you have to deliver a shock. After giving the shock, do CPR for 2 minutes. During that time only take an IVSS and then again analyze the rhythm after 2 minutes. If it is shockable, give shock. Now we have completed 2 shock. Now after 2 shock, IVSS already has been done. Epinephrine, then you have to start. Okay, after 2 shock. Now again after 2 minutes you have to analyze the rhythm. It is a shockable, give the third shock, you have to give it amiodarone. Okay, so after 2 shock we have to give epinephrine. After 3 shock we have to give amiodarone. Okay, ये क्वेश्चन पूछते हैं इन वाइवा एंड यू शुड बी क्लियर अबाउट इट. ओके, कूल. नेक्स्ट. So question came. Okay, so we'll go to the rhythms now. Okay, so what is this rhythm?
This is
Anybody?
monomorphic VT.
Very good. Good. Anybody is having a question regarding that? This? Okay, next. Okay, what is this?
This is VF.
Very good. Next.
Asystole.
What is this? Good. Any other slide is there, Dr. Akif? Yes. Now tell me what is this? If the pulse is not present, but some kind of the activity is going on. Okay?
Pulses are.
Yeah. Any other slide? Yes.
No,
Okay.
that's it.
Any question? Any doubt? Okay. Cool. Okay. Thank you, Dr. Akif.
Thank you so much, ma'am.
Thank you, Dr. Pooja. Yeah. Thank you everyone for joining. Yeah.
Thank
Take
you,
care.
ma'am.
Okay.